how do we know it actually works? Well, we know first of all from experience. I've talked to many health professionals around the world who've told me a very similar story. Often it's a story about one patient that really touched them, that kind of led them to a personal tipping point or a turning point where from that day on their practice began to change. They started to reconnect to the heart of the practice and they deepened their caring and compassion, and that gave them a whole new sense of joy and satisfaction in their work. So there are a lot of stories like that, but there's some really good science behind this. In the last 10 years, there's been a blossoming of a new science called positive psychology. In the past, psychology only thought about depression and anxiety and all the deficits, but there's a whole new science about how we can build positivity and resilience and well-being. And the latest findings from that science tell us that the pathway to positivity and well-being and flourishing is actually simple acts of kindness, gratitude, appreciation, and these are precisely the things that we want to encourage in a compassionate healthcare service. So there are pioneering researchers like Barbara Fredrickson. She's a renowned researcher and also the author of a best-selling book called Positivity. And she lays down all the scientific evidence for why attendance to these simple acts of kindness, of gratitude and appreciation and focusing on others can lead us to much better well-being and positivity and flourishing. We also know that when we fall into the daily habit of these practices, it actually changes the wiring of our brain. We begin, in our brain, there are different centers to do with positive and negative emotions. And it's not called the practice of compassion for nothing. It is something we have to practice at. And it's like going to the gym and exercising your muscles. They get bigger. When you exercise the parts of the brain that are to do with happiness and compassion and kindness, those parts of the brain actually change themselves. They grow new connections, new neurons, they get more blood supply. Those parts of the brain start to strengthen, and the parts of the brain to do with negative emotions and irritation and anger and so on diminish. So this is part of the well-being. We are hardwiring into our brain structural changes that make us more immune to the daily irritations of life and more sensitive and focused on the things that give us deep pleasure and satisfaction, and that's kindness and caring and compassion. So this is, we're rewiring our brains, and there's a tremendous amount of research to show that that's really happening. What the scientific research also tells us is that positivity and well-being and optimism is incredibly important for physical health. So we're not only doing something for ourselves, but for our patients as well. For instance, there was a study that looked at survivors of heart attack, and we did a longitudinal study to look at their length of survival and who had a heart attack, who died. And they divided these patients into groups based using a psychological questionnaire depending on the level of optimism or pessimism. And the death rate of the pessimist was about 3 times higher than the death rate of the optimist. I mean, these are really striking changes. And in one review of all the literature about the relationship between positivity and well-being, physical well-being, it's estimated the size of this effect, the difference in health status between the optimist and the pessimist, it's about as big as the difference between smokers and non-smokers. This is a really important effect. So if we as health professionals can come to our own health and well-being and positivity in the state of flourishing, then that's something we begin to transmit to our patients. When we make that deep emotional connection, we start to influence them to become more positive, to think more about well-being and resilience and strengths and positivity and optimism, and these are things that are going to protect them from disease in the future. There's also a wealth of scientific evidence that compassionate caring is better for patients. It achieves better outcomes. Patients have more satisfaction, they recover more quickly, they're less likely to get an infection, they get out of hospital quicker, they have fewer complications, and it seems to me there's quite a close relationship between compassionate caring and improving patient safety. Here's a recent example published in a prestigious journal, the Journal of the American Medical Association, JAMA. This was about a group of patients in the United States that have lung cancer. And they were offered 2 choices in their treatment. And this is all funded by their insurance company, which was Aetna. And they came up with a great idea. And they said, well, we will continue to fund all of your aggressive medical treatment, your surgery, your chemotherapy, all the kind of aggressive things we do to patients with advanced cancer. Or you can choose to have palliative care, but even if you choose the palliative care option, we won't cut off your entitlement to the aggressive medical care, so you can make a choice. When they'd done that, they then randomized the patients into two groups that either took palliative care or only had aggressive medical care. And then they looked at the outcomes. And they found that the patients who chose palliative care, that worked with physicians and nurses who really helped them to sort out their life goals and do what was really important for them, then, for instance, there was a very big difference rate in the rate of depression between the two groups. So the patients having the aggressive medical care, the chemotherapy, the surgery, about 37% of those patients had feelings of depression, symptoms of depression. The ones in the palliative care group, only 16%, so they were a lot happier in themselves. The costs of care were very substantially different. The patients that chose the palliative care option, the average cost of care in hospital and out of hospital was many thousands of dollars less. But this is even more striking. The patients who chose the palliative care option, they lived longer. They lived substantially longer. The survival time for the patients having aggressive medical treatment was about 8 or 9 months, and the patients who took palliative care lived for 12 or 13 months. This is really striking. This is compassionate, humane care that achieves better outcomes, happier patients, they live longer, and it costs less.